Today I will talk about how diabetes affects fertility in both males and females. Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. India has become diabetes capital of the world. Especially in the states of Andhra Pradesh and Telangana, diabetes is on high incidence and always on rise. Why this is so? Mainly because of our lifestyle. Sedentary lifestyle with no exercise, taking high carbohydrate, high in rice meals, and also having lot of junk foods, actually consuming more calories than required. All of these things are leading to diabetes. So what is important is prevention of diabetes with diet and exercise right from the beginning, like from childhood. What we should do is observe what foods are given to our kids so that they don't become future adults with diabetes. Nowadays, what we are seeing is the diabetes is happening even in young patients who are in their early 20s or early 30s. Usually, diabetes is type 1 and type 2 diabetes. But both the types of diabetes require diet control, which is most important, and medications. Now let us see how diabetes affect fertility in women. Women with polycystic ovaries have high incidence of insulin resistance, which means they have high blood sugar, elevated levels of hemoglobin A1C, sometimes requiring treatment for blood sugar control even in early adulthood or at least in pregnancy when they develop gestational diabetes. So insulin resistance is common in PCOD. If a patient has PCOD, we always do the test to check for the insulin resistance. High blood sugar can affect the egg quality. Because of high blood sugar, the HbA1c is increases. With these high levels of hemoglobin A1c, there is lot of oxidative stress which causes damage to the DNA of every cell of your body, including the egg cells. High damaged egg cells will result into poor quality eggs, also result into poor quality embryo, increased risk of miscarriages. Also in IVF or fertility treatments, what we see is diabetic patients have high incidence of implantation failure and miscarriages. If you have diabetes in pregnancy, it affects your growth of the baby. It leads to increased amount of fluid around the baby, what we call as polyhydramnios. It causes baby to gain excessive weight, which is not healthy, which we call as fetal macrosomia or high birth weight for the baby, making it difficult to have a normal vaginal delivery and pushing more for cesarean delivery. Also, these babies tend to have what we call it as apnea at birth or difficulty in breathing. Some of these babies may require an ICU admission because of high incidence of infections during pregnancy, like leakage of amniotic fluid or chorioamnionitis, all these leading to high risk for infections to both mother and baby. So it is important to control your blood sugar before you plan your pregnancy. HbA1c level above 7.5 is also associated with birth defects in the baby, even without chromosomal issues or genetic issues. So these birth defects can be related to the heart or the spine of or the vertebral column of the baby. So to prevent these birth defects which are related to diabetes in pregnancy, before you plan your pregnancy, your HbA1c levels should be less than 6. So this was about how diabetes affects female fertility. Now coming to the male fertility. How diabetes affects male fertility. Because of the diabetes and high blood sugar levels, there is increased oxidative stress which damages all cells of your body, including the sperm cells. High damage to the sperm's DNA, which is also tested by sperm DNA fragmentation index, leads to the poor quality sperms, which leads to poor fertilization, poor grade of embryos, and also responsible for miscarriages because of the high DFI. Other than the sperm quality related issues, men with diabetes usually suffer with problems related to their sex life, like ejaculatory dysfunction or erectile dysfunction. This is because of the parasympathetic nerves which get affected because of the high blood sugars and leading to the nerve damage. So, what as patients with diabetes who are trying for pregnancy should do is proactively control their blood sugar with diet, exercise, and proper medications. Consult a fertility specialist in time and follow their advice. What doctor or a fertility specialist usually does is make sure that you have good metabolic control before we start your fertility treatment so that your chances improve with the treatments. And also the patient should understand that fertility is not in isolation. Your general health, like including diabetes, will affect your entire body, including your egg and sperm quality and pregnancy and future baby. So if you are trying to conceive with diabetes, I hope this message was helpful for you.